Good evening, everyone. It's a pleasure to be here. It's a particular pleasure for me to be on a panel at the Paul Torrens Health Forum because Paul was my mentor and hero when I was at the School of Public Health. So it's really good to be here. And Mark, I hope you're right that 20 million people aren't going to lose their insurance because it would have a devastating impact on the people who have gained coverage through the Affordable Care Act. I serve a community that has been significantly benefited by the Affordable Care Act. I serve the community of South LA, which includes Watts. And this is a community that has been struggling with being medically underserved for decades and continues to be medically underserved. The good news is that the Affordable Care Act has provided coverage for a significant number of people who live in that community. And as a hospital, a new hospital in that community, we see those people every day. And I sincerely hope that they won't lose their coverage. And when I was asked, what are you doing to respond to the potential repeal of the Affordable Care Act, the major answer that I had was telling our story, telling the story of the people who we serve at our hospital and our community, and advocating on behalf of those folks. That's what we're doing. So I'm going to start by giving you a little bit of background on our hospital for those of you who aren't familiar with our hospital. We are a private, nonprofit, safety net community hospital. We are in a unique public-private partnership with the County of Los Angeles and the University of California. We are a brand new hospital that has replaced a hospital that failed in 2007. Many people know the story of the old King Drew Medical Center that closed as a result of poor patient care and safety problems. And we are a brand new hospital located on the same campus, but a completely new and different organization. I tell people the only thing that has remained the same at our hospital is the zip code. We serve over 1 million residents of South Los Angeles, and it's a community that is severely medically underserved. It is 70% Latino. It is federally designated as both a medically underserved area and a health professional shortage area. So even with the enhanced coverage residents have gained under the Affordable Care Act, there's still a lack of access in South LA because there are not enough providers in South LA. As soon as we opened our doors, our hospital was inundated with patients. We are a small hospital. We're 131 beds, and we're not a trauma center as the old hospital was. However, we have one of the busiest emergency departments in the county. Within the first 6 months that we were open, we had more paramedic runs at our hospital than Harbor UCLA, which is a much larger hospital. We see more patients in our emergency department than Reagan UCLA. We are now seeing annualized about 80,000 patients a year in our ED, over 6,000 a month. So a very busy hospital. We also have a full inpatient service now. You know, this is the flu season, so hospitals typically fill up at this time of year, and our hospital is just overflowing with patients. The patients that come into our emergency department fall into two categories. On one side are the 30% of patients on our emergency department who have low acuity conditions. They actually don't need to be in an ED. If we were in Culver City or Beverly Hills, they would be in an urgent care center or in a private doctor's office. But because we're in South LA and we have a 1,500 physician deficit in South LA, they're in my emergency department. And they're not there because they're ignorant and don't know how to use the healthcare system. They're there because they need care and there's nowhere else for them to go. The second category of patients that we see are patients who are severely ill. These are people who have gone for years without adequate health care, and they come in with advanced medical conditions. We have an MRI scanner at our hospital. Our MRI scanner is busy almost all day scanning diabetic feet. One of the most frequent procedures we do at our hospital is limb amputations for advanced diabetes. So this gives you an idea of what the folks that we're serving are like. And even with that story, they've benefited from the Affordable Care Act because now they can access at least some primary care and some follow-up care. And they feel free to come into our emergency department. I'm proud of the fact that we've been open a little bit over a year, and we already have some of the best quality results in the region. We have very high patient satisfaction. Our patient satisfaction scores are higher than 83% of hospitals nationwide. And we're doing great from a quality perspective. This is our mission, vision, and values. And I put it up there because this is what guides our work every day. And when I'm asked, how are you proceeding through these uncertain times? And how are you helping your staff cope with the uncertainty? My answer is, we continue to focus every day on our mission, vision, and values. My job is to keep our folks focused on that. So regardless of what happens with the Affordable Care Act, we will continue to focus on becoming a model of care and providing compassionate care inside of our hospital and working with others outside of our hospital to improve the health of our community. So then I was asked, well, what does your financial situation look like? So this is a little bit about our finances. Our payer mix is one of the worst payer mixes for a hospital in the state, particularly for a hospital that is not a public hospital. Our payer mix is 78% Medi-Cal, and the rest of it is pretty much uninsured. We do about 4 to 5% commercial insurance. And for those of you who aren't familiar with Medi-Cal, 1 in 3 Californians is insured through Medi-Cal. And approximately 6 million Californians gained coverage through the Affordable Care Act with the expansion of Medicaid. And that was both through an expansion of eligibility for Medicaid. The federal poverty limit rose from 100% to 138%. But it was also through something called presumptive eligibility, which a lot of people don't know provides coverage for people who are not ordinarily eligible for Medicaid, like undocumented immigrants who get a limited coverage from Medicaid. So right now we are very financially stable. We're doing fine. However, 20% of the patients that we serve are covered through either the Medicaid expansion or the subsidized insurance exchange. Like every other safety net hospital, we also receive supplemental funding because you cannot run a hospital on Medicaid payments, particularly in California, where the provider payment rates are almost the lowest in the country. So we do have supplemental funding. The threats to us are the threat of the rollback of the Medicaid expansion and the potential block granting of Medicaid contributions from the federal government. Because block granting or per capita payments is a way for the federal government to limit the growth of Medicaid spending. So the impact that this would have on us would be potentially fewer people covered, although California is a state that has always had pretty generous coverage for its residents. But potentially rolling back that coverage, higher uncompensated care as a result of that, and lower revenues. So the impact on us would be that we would continue to have patients coming in, but we wouldn't have as much money to take care of them. So then I was asked, what are you doing to contingency plan? So what are you thinking about as you think about the potential changes? Well, it's pretty simple, really. Staying informed about the policy proposals. So I've become a little bit obsessive. Every morning when I wake up, I reach for my iPad as soon as I wake up, and I start looking at the news. And I'm looking to see where we're going today. Is today the day? Pardon?
And you get out of bed after that?
Yeah. Some days it's a little more uplifting than other days. Is today the day that Donald Trump says we're going to cover everyone? Or is today the day the Republicans say, no, he was just kidding? So trying to stay informed about the proposals that are being put on the table. Then evaluating those proposals. What would those proposals mean for our community, for the population that we serve, and for our hospital? And I work very closely with my very experienced chief financial officer to model the changes that could come about. So, pretty quickly, we figured out what would happen if the Medicaid expansion was rolled back. What would that mean to us in terms of the various different sources of revenue that we get from Medicaid, and looking at how that would impact our financials. The other thing I do is I advocate on behalf of our community. So that means that we need to have a voice. And we want to have a voice in the federal debate that's taking place. And if Medicaid is rolled back, we need to have a voice at the state level. Because if the federal government decides to roll it back, and if they decide to block grant Medicaid, the fight and the debate is going to be taken to the state level. And it's going to be about how those limited dollars are allocated across the state. So we need to have a voice there. We need to have relationships with elected officials, with our advocacy organizations and our trade associations, and we need to be part of that discussion. The other thing we do is what we do every day and what every healthcare provider is doing now, which is striving to be as efficient as possible, as disciplined as possible, to reduce variation in care and in operations, to manage our expenses effectively. None of that has changed. We've been under that pressure for many years to be more efficient with how we use our resources, and we continue to do that. And part of that is innovating to enhance quality and access to care in our community, and figuring out ways to add the care continuum. So one of the changes that we recently made is we opened a new post-discharge clinic. This is our first outpatient clinic, and we refer patients directly from the hospital who are being discharged to our outpatient clinic. And we try to break that cycle of leaving and coming right back in. We also know that we may need to renegotiate our funding sources, and we're prepared to do that. So at the end of the day, here's what I'm thinking. No matter what, we don't panic, we stay calm. It really is too early to know what's going to happen. We continue advocating. We continue working with the various stakeholders, and we continue to maintain our focus on our mission, our vision, and our values. So that's what we're doing.